Like I mentioned, my name's Mac, and I'm here with Dr. Shalz today to offer you a Lifestyle is Medicine webinar. And so if you are not familiar with Dr. Shalz, she is the medical director of St. Luke's Lifestyle Medicine Department. She develops and directs programs that use lifestyle interventions to help prevent, treat, and reverse chronic disease. She's passionate about helping people not only live more years, but put more life in their years. And current programs under her management include cardiac, peripheral vascular disease, and pulmonary rehabilitation, nicotine dependence treatment, care transitions, the St. Luke's Complete Health Improvement Program, also known as CHIP, and the St. Luke's Center for Lifestyle Medicine at the South Meridian YMCA. So today she's going to be discussing how we can reduce inflammation by practicing optimal lifestyle behaviors. So thank you so much for being here, Dr. Shalz. We appreciate your time, and I'll let you take it away. As she pulls up her screen, if you can just save your questions for the end, and you can type those in the chat box as they come to you. We'll get those answered at the end. And Dr. Shalz, you are now on mute as well.
Okay, so am I unmuted?
Yes, you are. Mm-hmm.
Okay, thanks. And also, can you see my screen?
No, we cannot. So you'll have to share for us.
I'm sorry, everyone. Let me. Okay, so now you can see my screen.
Yes, you've got it.
All righty. Excellent. Okay, and you can hear me. All right. Well, thank you, everyone. Good afternoon. It's an honor and a pleasure to be given the opportunity to talk to my colleagues at Luke's about lifestyle as medicine. We all know in healthcare, a healthy lifestyle has long been recommended for optimal health. Yet education about the science of lifestyle, and especially the science of behavior change, which is really the hard part, are not routinely or adequately addressed in medical training. And this has led to an emerging subspecialty called lifestyle medicine. And the elevator speech for this is that, and this was used in the intro, but it's the use of evidence-based lifestyle interventions to prevent, treat, and in some cases even reverse chronic disease. And we do that by addressing the root causes. Today, I'm going to present some facts about the rising tsunami of chronic disease that affects us here in the U.S. and discuss what factors are contributing to this epidemic. And then I'll review current scientific thought regarding how certain behaviors cause these conditions. And I'm going to finish with giving North Star recommendations on the health habits that help all of us thrive. When I talk about epidemic, this is what I mean. This is from the American College of Lifestyle Medicine, and 60% of Americans have at least one chronic disease. 40% have more than two. Actually, this compounds the suffering and the costs that people have that are associated with chronic disease. Many of us will develop cancer throughout our lifetimes. Half of us will have cardiovascular disease. And in fact, the #1 and #2 causes of death in our country are indeed heart disease, at about 32% or so of us, followed closely by cancer. And yet, and it is about the early mortality, but it's also about the disability that comes with chronic conditions. So what's driving some of this epidemic? I will tell you that type 2 diabetes is now present in 10% of the adult population in the US. And according to the American Diabetes Association, people with diabetes in 2017, so this is a few years ago, actually incurred average medical expenditure of about $17,000 a year. Almost 10,000 of that attributed directly to their diabetes. That means that if you had diabetes, your expected medical expenses were 2.3 times higher than if you didn't have diabetes. And why do I mention that diabetes could be a cause of driving some chronic disease? It's because it is a risk factor for heart disease, and also is a risk factor for, it's associated with cancers as well. And behind this, we have prediabetes. More than a third of Americans right now who are adults have prediabetes, and 90% of us don't even know it. And the issue with prediabetes is yes, it does put you at risk for developing frank diabetes over the next few years, but also having prediabetes is not a pre-disease. It actually already starts to have negative impact with high blood sugars. These high blood sugars are having negative impact on nerves, on kidney health, on the health of your eyes, and even with your brains, with the risk of dementia. So it's something that if we could reverse it, we would want to reverse it. And so what's driving this epidemic? Well, at this point, the thought is that many of us in the United States, this is an old slide, it was 72% a couple of years ago, are dealing with being overweight. So this is the majority of us, but now it's up to 74%. And a big driver of diabetes, heart disease, and cancer is excess fatty tissue, what we call adiposity. So this is higher than we've ever had before, and we think that this is driving things. Excuse me. Also, there's an additional cause of suffering and cost to individuals as well as society, because 1 in 4 U.S. adults that of working age are living with some sort of disability and disproportionately have these same conditions. So is the issue that we're not spending enough money on healthcare? We have a lot of expertise in the United States. I mean, we think of our healthcare system as some of the best in the world. And yet when you look at the numbers, there's something very suspicious. So on this graph here, you can see on the x-axis, health expenditure per person. And you can see this was actually in 2015. It's even worse now. But the United States is spending more money per person in the United States than any of these other countries that are very similar in terms of wealth and quality of life in their countries. And then when you look over here at life expectancy, the United States is not as high as these other countries. And in fact, you can see, this was the latest information from last year, countries ranked by life expectancy were number 46. We spend more money on healthcare than any other country, and more money now than we ever have, and yet our life expectancy continues to drop, both in the ranking, but also recently it's been dropping for a lot of reasons. One of the reasons here is where we're putting our money. Our current healthcare approach, as you all know, and you work for a healthcare system, is a sick care system. We respond to these conditions once they begin. And in fact, Americans with 5 or more chronic conditions make up 12% of our population, but they're accounting for 41% of the total healthcare spending. Why is that? Because we're spending very little on preventing these conditions in the first place. So the reality is that we're spending the largest amount of healthcare dollars holding at bay these diseases that need never have existed. Now, why do we think prevention is so powerful? It's because that's what the data is showing us. And in fact, 16 years ago in 2005, looking at the available evidence at that time, the World Health Organization came out with this extremely bold statement and said 80% of premature heart disease, stroke, and diabetes can be prevented. And they said 40% of cancers could be prevented. How can they be prevented? They said it had to do with the way we're living. So I'm going to get into some details on that in a second. And this is being echoed by many others since that time. In fact, here you can see this pie chart from the American Hospital Association from 4 years ago, looking at what determines health in a population. And of course, they were focused on the impact of health and medical care and access to care, good quality care, making sure your provider is competent. Look at that pie chart. Look how little the percentages at 11% health and medical care plays a part. The biggest part of this pie has to do with the way we live, our behaviors. And specifically here you can see they're calling out nutrition, physical activity, healthy weight, substance use, emotional wellness, adequate sleep, 36% of health being determined by that. How much do we focus on that in our day-to-day lives and work here at St. Luke's? And do we focus on it in a way that's actually effective for people and meaningful? I also want to call out that social circumstances are also very important. This is also the way we live, isn't it? Do we have jobs? Do we have transportation? Do we have housing? Do we have access to healthy food? These are also very important contributors to our health. So 60% of this pie has to do with how we live. So I want to go over the chronic disease risk factors, the risk factors that come from our health habits. And I want to start with the ones that the World Health Organization actually underlined as number 1, 2, 3, and 4, and in terms of importance and power in causing chronic disease and or cancer. And the number 1, I'm wondering if you guys are guessing this, is poor quality diet. Poor quality diet is the number 1 risk factor for chronic disease and potentially cancers. And when the World Health Organization defined this, they actually did not say the world is eating too many chicken McNuggets. What they said was something, they flipped it, and they said the world is not getting enough of the health-giving, nutritious foods that they need to be getting in their diet. You're not getting enough. And what they said was, we're not getting enough fruit, we're not getting enough vegetables, and we're not getting enough whole grains. So think about your own diet. Think about your own diet. Think about the way you grew up. Think about what you're feeding your cells and your families. Think about the standard American diet. How much do we focus on getting fruits and vegetables and whole grains? And in fact, the USDA has been recommending for years that we get 5 to 9 fruits and vegetable servings a day. That takes some effort, especially in the way that we eat here in the United States. The second thing that was the most important was inactivity. Being inactive and sedentary kills. In fact, there's even this statement going around, sitting is the new smoking. We know that the human being, the body, needs to move in order to be healthy. And when we don't move, bad things happen. The third is tobacco. I don't think that's a great surprise. Maybe the biggest surprise is that it wasn't number 1 or number 2. And then the fourth thing that they called out was excessive alcohol consumption. And we're going to talk about this in a little bit more detail later, but alcohol consumption, you don't have to be drunk in order to have negative impact from alcohol use, especially if you're if you routinely use alcohol. So these were the top 4 things that the World Health Organization called out. But I'm going to also address some of the other things that were also on the slide with the pie chart. Everyone wants to know about genetics, right? And it is true that genetics definitely play a part in developing chronic disease or cancers. But what we say is that the genetics loads the gun for disease risk, but it's your lifestyle that pulls the trigger. So why do I say that? It's because scientists have found that, of course, we cannot change our genes, right? We have genes from our mother and our father, and we can't change those. But those genes have switches on them. Genes can be switched on, and genes can be switched off. Bad genes that cause disease can be turned on, and they can be turned off. Good, health-giving genes can be turned on, that are protective, can be turned on, and they can be turned off. So what turns them on and off? Because, by the way, it's not predetermined when you're born. What turns them on and off is actually the environment that the genes are in. It's the way we're living. It's the toxins that we're exposing our genes to. It's the amount of, I'm going to use this word, inflammation in our bodies that we're exposing our genes to. And it's a whole area of study called epigenetics. But we have seen in multiple chronic conditions, including heart disease, early prostate cancer, and some other conditions, how much the role of your health habits and your lifestyle and the amount of inflammation in your body affects whether or not you have good genes turning on or bad genes turning on. The next one is overweight. I've already talked about the fact that it's becoming normative at this point, right? 74% of us have excess what we call adiposity or fatty tissue, because we're not talking about excess muscle or bone, are we? And why is excess fatty tissue really even an issue? It's an issue because it has mechanical side effects, right? So if you have excess weight, you might have more aching in your back and in your joints. And when you exercise, you're more short of breath, or you don't feel as well, or you have low energy, or maybe it causes urinary incontinence, or you have rashes, or something that's a mechanical side effect of that you don't like, that's associated with having excess fatty tissue. But it's more than that. We know that fatty tissue actually is hormonally active and chemically active. So we all need fatty tissue, but it's when it's in excess, and particularly when it's in excess where it is around our organs and in our abdomen, and our waist size are enlarged, that you actually see these negative effects. So you see hormonal effects where estrogen levels are going up at the detriment of testosterone, which goes down, and that happens in men and women. And also, it actually plays a part of contributing, just like the immune system, of contributing inflammatory proteins. Excess fatty tissue actually releases inflammatory proteins. It creates and releases inflammatory proteins. And that's what causes the heart disease and the diabetes and cancers and depression that are associated with excess fatty tissue. Now, we cannot separate our emotional wellness from our physical self. In fact, there are a few emotions that human beings find particularly distressing that actually lead or could lead to premature physical illness like diabetes, heart disease, and dementia as adults. It's kind of crazy to think about that. One of the biggest negative emotions that one of the emotions that has one of the biggest effects is loneliness. And just like people are noting that we're having worse diet, worse activity, gaining weight, drinking more alcohol, etc. during the pandemic, guess what else is happening? Worsening loneliness, worsening with our social isolation. So we are seeing premature death from those conditions that I just mentioned. Additionally, chronic depression, especially when there's another chronic condition, say like heart disease, for example, can actually worsen the outcomes that are associated with those other chronic illnesses when it's present at the same time. And of course, decreasing our quality of life, etc. And we also have to talk about chronic anxiety and the toxic stress that can also happen and start happening in childhood with adverse childhood events, which are things that happen to people that are outside of their control, that are traumatic and occur in childhood. And 4 or more of these adverse childhood events are associated with an increased risk of chronic conditions, like I mentioned. So very interesting that it's not just what's happening to us as an adult, but even side effects of what's happened to us as children. Or sleep. You can't separate, so just like emotional health from physical health, you can't. Somebody's on the microphone if they could mute themselves. But also you can't separate poor sleep from good or sleep from good health. It's not a nicety, it's a necessity to have sleep. This is where your body regenerates. And it doesn't just regenerate cells from below the neck. This is where we work out our emotional life, where we work out our learnings, our knowledge is solidified while we're sleeping. This is where our cognition is affected. And we see a lot of negative chronic conditions, including dementia, diabetes, congestive heart failure, atrial fibrillation, high blood pressure, stroke, etc., when there's poor sleep, especially in the form of untreated sleep apnea. And then aging. Aging, of course, we're all going to be doing, hopefully. There's no really great alternative outside of that, but how you live actually can speed up or slow down the effects of aging. So how do these behaviors, what we do in our lives, which by the way, we do not just for a day or two, we usually do for decades, years at least, how do these behaviors actually lead to the chronic diseases that I keep talking about? Well, it has to do with the immune system. So the immune system works by releasing, when there is a noxious thing that's occurred, whether we've had an injury or there's a virus or bacteria or something like that, our body, the adrenal gland, releases some inflammatory proteins. And those inflammatory proteins might actually result, you might actually see them at work with pain and redness and swelling and heat. That's actually inflammatory proteins at work. They're trying to heal you, right? And once you're healed, those inflammatory proteins diminish and go away. And then when there's another insult, your immune system responds appropriately. And that is the way it should be. But what happens when you have a behavior, say, that the body finds stressful? So like, remember when I said the body's meant to move. If you're inactive all the time, for example, the body is meant to move. The body is stressed out when you're not moving. The brain tells the adrenal gland, I'm stressed here. And the adrenal gland responds, maybe not in a humongous way, but it does release some inflammatory proteins in response to that stressor. And if the stressor never goes away, and especially if there's other stressors, we're not sleeping, we're very anxious and depressed, maybe we're smoking, we're eating processed foods, all of those things add up. And what you get is chronically elevated inflammation. So here you have another way of looking at this. You have bodily stress from the toxins that you may be exposed to, from your behaviors that you may be participating in that the body finds stressful, and then adiposity, which is excess fatty tissue. The body releases inflammatory proteins. You get this chronic elevated inflammation, which is like a low boil that's always up of inflammatory proteins. And what they do is 4 specific things that lead to disease. Number 1, it causes insulin resistance. Insulin resistance is what leads to prediabetes, diabetes, fatty liver, high triglycerides, low HDL, and some other conditions. Number 2, it increases your risk to have a blood clot. One in the leg, in the lung. You can have a blood clot in your coronary artery, a heart attack. In the brain, it's a stroke. It also keeps the blood vessels from operating normally. So normally your blood vessels respond to your physical, emotional, and even sexual needs by opening up the arteries fully to allow great blood flow where and when you need it with good oxygen. And this is life-giving, energy-giving blood. But when there's a lot of inflammation in your body, you don't get great blood flow throughout your body like you're supposed to be getting. And so what happens is that you feel sluggish, you have low energy, you have some fatigue, you feel like you're achy, and it starts to cause damage and problems to your organs over time. You're not getting the blood flow you need. This happens with people with coronary artery disease as well. Lastly, direct tissue damage happens with inflammatory proteins. They actually do damage your joints, your discs, your organs, and over time it just builds up and there's worse damage. So it really behooves us to try to decrease the amount of inflammation in our bodies. And we can do that by addressing the way we live and diminishing the toxins that we're exposed to. So the American College of Lifestyle Medicine actually says that we can focus our efforts here on 6 different areas to improve our health. So we're talking about increasing the consumption of whole, not processed, mostly plants in our diet, of increasing our aerobic activity and strength training along with physical activity in general, optimizing our sleep, decreasing substances, and importantly, look at this, fostering close relationships in your life, maintaining purpose, and learning some skills to manage your symptoms of anxiety and depression. So it gives us some recommendations here to start working on these areas. And so what I'm going to do next is go over some of the North Star recommendations in each of these. So when it comes to nutrition, this is always the biggest confusing part of things, isn't it? There's so many people trying to sell you things out there. There's so many fad diets. There's so many misinformation. But I think what I'm telling you today will actually is echoed pretty much everywhere. And that is that our standard American diet is killing us. You've already seen the slides. You've already seen the data. We've talked about it. But specific elements include simple sugars, for example. Simple sugars, which are carbohydrates that have had all of the fiber and nutrients stripped out of them, actually are not just going to cause us to gain weight and not maybe give us a headache and all of that, a sugar high and then a sugar low. What what it does is actually causes inflammation. So simple carbohydrates in our diet, especially if we have a lot of them, can cause inflammation. And these include white flour and white rice and all of those, okay? Along with, the usual suspects of candy and cakes and sugary beverages. And by the way, fruit juice goes in here too, because again, the fiber and the nutrients have been taken out. The next is processed foods. All those chemicals that you can't pronounce, those are causing inflammation. And a big subset of that is processed meats. If you're going to eat meat, processed meats are the ones to really minimize or avoid completely. And those include, of course, all of our favorites, right? So bacon and hot dogs and sausage and pepperoni and lunch meat, etc. It's associated with causing colorectal cancer at the very least. Also, we talk about animal products, including red meats, right? You hear red meats, especially the American Heart Association, talking about how it increases our risk for cardiovascular disease. There's evidence that it can, if you eat a lot of these products, that it can shorten your life. It can increase your risk for cancer and other chronic problems. Why is that? Well, I think for a long time we were thinking it was mostly the saturated fat, the cholesterol, because by the way, you can only get cholesterol in your diet from animal products, and we don't need cholesterol in our diet because our liver makes it, but they thought it was that. But now we are understanding that probably it has more to do with the gut bacteria and how it breaks down certain foods in our guts. So when it comes to meats, for example, the proteins in those meats are being processed by the gut bacteria into and metabolized into inflammatory metabolites that we then reabsorb and contributes to our inflammatory burden. And so that's the current thought around this. Also, the same thing could happen with dairy products. About 70% of US adults actually have antibodies to dairy proteins. It's not just about the lactose. And so dairy is well known to cause heartburn, diarrhea, constipation, bloating, and potentially eczema and acne and things like that. So maybe not everybody has those antibodies, but a large proportion of us do. And that, of course, can contribute to the immune system being all revved up. So what does anti-inflammatory eating look like? Well, over on the other side of the slide, you see the fruits, the vegetable, the whole grains, all mentioned by the World Health Organization, along with nuts and seeds and lentils and legumes and beans. Well, these are very anti-inflammatory. Why? Well, looking at all of the color that is in them, those colors actually represent what we call phytonutrients, which are anti-inflammatory, antioxidative. They decrease our inflammation actively. Number two is that they're full of fiber. And by the way, you can only get fiber from plants. And fiber is essential for good health, good gut health. It lowers your cholesterol, lowers your blood sugar. But importantly, again, getting back to the gut bacteria, there are gut bacteria that metabolize foods to anti-inflammatory metabolites, which we reabsorb. And guess what they thrive on? Fiber. So the more fiber in your diet, the better. And also, those foods are inherently full of hydration. Those hydration molecules give us energy, give us life, help us feel good. Our standard American diet items do not have very many hydration molecules at all in them. And not only that, if you're trying to manage your weight, if you have a diet that's made up primarily of these items, these are nutritionally rich and you'll feel great, and they are calorie poor. So you can eat plenty of these without feeling restricted and actually manage your weight even better. Additionally, I want you to look at this slide because it gives another way of looking at where you should put your efforts in terms of getting mostly these plant foods here at the bottom of the pyramid, and anything else that you're going to eat to minimize, to really, and this represents the standard American diet right up here, doesn't it? Additionally, anything you can get along the continuum here, away from the standard American diet, maybe towards the Mediterranean diet, or maybe even towards even greater amounts of whole food plant-based in your health, in your diet, you're bound to have better overall health. Now I'm going to talk about physical activity here because, as I was saying, sitting is the new smoking. You want to limit sitting. I have a sedentary job. I have a stand-up desk. It goes up and down. Pacing is better than standing, but anything is better than sitting all day. And so even getting up and walking down the hall is better than just sitting all day. But additionally, planned physical activity, which is exercise, is vitally important to, it affects every organ in the body. And the amount of exercise is recommended to be at least 150 to 300 minutes a week of moderate intensity aerobic activity, where your heart is up for at least 10 minutes at a time. And by the way, if you just do it in 10-minute snatches, that works. So you can do 10 minutes multiple times a day during your workday. And then strength training and stretching 2 days a week, optimal to decrease inflammation. We talked about increasing weight, and here this is a body mass index, which by the way is a height weight calculation, and you can Google this for yourself and find out where your body mass index is. But the higher your body mass index, the higher your risk for chronic disease is what this chart is showing. But also, even if you have a normal weight, if your waist size is greater than these inches here that I have, you also have an increased risk, because that's where the fatty tissue is up and around your organs and causes the worst damage, the most inflammation. But the good news is that 5 to 10% weight loss can actually reverse and improve some chronic diseases. So this is super exciting. You can reverse prediabetes with 5% weight loss. You can potentially reverse diabetes, depending on how long you've had it, with 10 to 15% weight loss. Fatty liver disease, the most effective treatment for fatty liver disease and reversal of fatty liver disease is 10% weight loss. And if you have osteoarthritis with pain in your knees, you can drop your pain by 50% with 10% weight loss. Anti-inflammatory with even this amount of weight loss. We see it metabolically, we see it in the way you feel. It's a good thing to shoot for. We already talked about the inflammatory effects of loneliness, chronic depression, toxic stress, and anxiety. Well, the antidote to that is actually building our personal contentedness. The more content you are, the more you have inflammation coming down. And there are ways to actually become more content. Things that you can do deliberately. This can be through mindfulness and meditation and relaxation. This can be through gratitude practices, working on your relationships and having supportive ones in your life, increasing your hobbies and your sense of accomplishment and purpose. All of these things, even laughter, can increase your personal contentedness. It lowers our inflammation. And when it comes to sleep, 7 to 9 hours of uninterrupted or pretty good quality sleep, where maybe you get up to go to the bathroom once or twice and go right back to sleep. That's good quality sleep. If you have sleep apnea, treating your sleep apnea. Or if you don't know if you have sleep apnea, finding out and then treating it if you have it. Very important for good health and to decrease inflammation. And then lastly, I want to say substances. You know, I think it's enough to know here that tobacco and vape and recreational drug use, even marijuana, which I know is available all around us now. Just because it is available and is legal does not mean that it's not causing inflammation in your body. These all can cause inflammation in your body. And alcohol. So I want to talk about alcohol because when I went through medical school back in 1990, they talked about it like it was a health food. 1 to 2 drinks of red wine a night is good for what ails you and helps your heart. And, it might actually improve your HDL cholesterol in some way, but in the end, it actually can be damaging to the heart. It can cause atrial fibrillation, even at routine amounts like this, can cause and contribute to atrial fibrillation. It can cause congestive heart failure. It raises your blood pressure. It can cause, of course, liver disease, mood problems, sleep issues, worsens your sleep apnea. But really importantly, the most recent information about the negative impact of alcohol, even in those of us who drink routinely and maybe don't ever get drunk, is the cancer risk. There is no apparent safe amount of alcohol when it comes to cancer risk. So it depends on you just realizing that and knowing it and putting it in perspective with the rest of your habits and your own personal cancer risk. So if you're looking to change, and I encourage all of us, I always am looking to improve my my health behaviors. But what really helps is to remember that none of that perfection gets in the way of this, because life is messy. And to be successful with actually adopting habits as a lifestyle, it's all over the place. It's like 2 steps forward, 1 step back, but you have to keep a flexible mindset and a big dose of self-compassion. And in that way, it actually can be incorporated, and you can find some ways to go over and around and beyond the barriers that your life might present to you at any one time in adopting some of these healthy habits. So remembering that it's a journey. And if you need some help at all, our department is here, not just for patients or the community members. Our lifestyle medicine department is here to support you. In fact, the health benefits program does help subsidize the complete health improvement program, which is a focus on nutrition, plant-based, and learning how to eat plant-based. But by the way, they're improving this program. By the summer, it should be even that much better and help people with health behaviors more than it does even now. Our intensive lifestyle medicine program, which is, by the way, all of these are virtual. So you can do these from anywhere in the whole system. Our nicotine dependence treatment program, our cognitive behavioral therapy for insomnia. We've had a little bit of break from that because we're having some staffing changes. What we're hoping to start again with cognitive behavioral therapy for insomnia in over this next year, in the next few months. And we have lots of community education courses, which are free to low cost to anybody. And you can find all of these programs and how to get into these programs and do these virtual, have these virtual opportunities available to you through our website, stlukesonline.org, Lifestyle Medicine. But I also want to show you this video because this is from our intense lifestyle medicine program. And what I love about it is just that this patient is having an incredible experience, and she's having an incredible experience because she's getting a help from a team of people who are there to walk the walk with her and support her in every way. So take a look at this, and then we'll.
Jennifer, I don't think we can hear the sound.
Oh, you can't hear the sound. Okay.
If you hover on your screen up top, there might be a little audio button you need to click.
I have it up my maximum here. Let's see. Shoot.
Sometimes it's just a matter of sharing the audio, and it's kind of odd. You have to just take your scroller and scroll up top a little bit farther with your mouse up towards the middle. Sometimes it'll pop up for you.
Can you play it from your end? Because you have it up.
You usually have to select it when you share your screen.
Ooh, okay. So if you want to unshare and then reshare, Dr. Shalz, I bet it'll do it for you.
Okay, let me try that.
There should be a little clickable audio.
Audio, include computer sound. There we go.
Perfect. There you go.
All right. All right, so let's see if this works. Thank you for being patient with me.
Yeah, I have the best job in the world right now, as far as I'm concerned.
Hear it?
Because I believe so much, because I see it every day in the power of helping people take charge of their own health.
If it wasn't for this program, I don't know where my life would be. I see where I'm at now, being able to do activities I haven't done in years. I am so grateful to lifestyle medicine because it has really saved my life.
When I practiced primary care, I felt like I tried to do a great job talking to my patients about their health habits. And yet both my patients and myself were frustrated over and over again when nothing really had changed. And in fact, oftentimes things would get worse with their chronic conditions. I got a great opportunity at St. Luke's Health System. And when I walked in the door to interview for that position, I just knew that this is really where my life was going to go, because what I witnessed was team-based care, and that these patients were actually improving their quality of life and their function. I really got excited at the possibilities that this is really the way healthcare should go, and we should find a way to make that work for patients and for healthcare systems.
I got involved in lifestyle medicine about 8 years ago when when we weren't even kind of thinking or using the terminology of lifestyle medicine. Having that multidisciplinary team really allows all of those specialists to focus in on their specific pillar. I'm not an expert in behavioral health. I'm not an expert in sleep or diet. And that's where we really rely on our dietitians, our social workers, our clinical psychologists to bring that expertise to the table so we're treating that whole person.
St. Luke's had the vision that they would be moving into more of a value-based care model. So when the opportunity presented itself with the Treasure Valley YMCA reaching out for a healthcare partner, St. Luke's raised their hand and came back to myself and my partners in our department and said, we'd really like you to design and build a clinic that offers health habit improvement programming.
What brought me initially to St. Luke's was my health had deteriorated a lot. I had diabetes, also cirrhosis of the liver. On top of that, I also had chronic fatigue, and it made a big difference coming to lifestyle medicine and being able to have not just one person, but an entire staff that was there to help me through, no matter what it was. At first, it was a little, intimidating for me because I didn't know what to expect.
At some point, it became obvious to her that she needed to jump way into the water.
With the plant-based diet, it allowed me to reduce my medications. It has a direct result on the chronic fatigue. And it took me a while to understand that. It took me a while to understand the stress that my body was under.
She started to address her sleep issues and her energy started to improve. And all of a sudden, this sort of fed into this cycle of virtue that helped her become more confident. And she really has made remarkable improvements. In fact, she started to thrive.
I'll never forget Dr. Shalz called me after I'd had blood work done, and she said, your results are normal. And I just started bawling because I was so excited and so happy and so grateful. If it wasn't for lifestyle medicine, that would have never happened.
It's hard. It's not easy. If it was easy, everyone would do it. But, sometimes those hard things are the right things to do. And that's going to be kind of the wave of the future, is that more and more payers are going to be covering kind of these non-traditional lifestyle medicine services. And then hopefully in the future, we can drop that non-traditional, and these are just going to be traditional services that every single patient expects to have as part of their benefits.
When you can teach people how to take better care of themselves and overcome barriers to making sustainable health habit change, and they start reaping the benefits and start feeling better and start becoming more confident and building self-esteem, and then they're influencing their other family members and their neighbors, you are throwing a little rock in the pond here and having this incredible ripple effect on people's lives.
Well, thank you so much.
That was fantastic, Jennifer. I do have some questions in the chat box if you have some time, Dr. Shalz, to go through those. Is that okay?
Sure.
Okay. So one question, it was when you were sharing the statistical information on the 40% reduction in cancer possibility, we had someone miss the source on that. It sounds like they want to investigate that a little bit more. Was that the World Health Organization or somewhere different?
It's from the World Health Organization, yes.
Okay, perfect. So that was our first one. And then when you were talking about processed meats, there was a question that says, what about boar's head turkey with no nitrates? Is that okay? Nitrites.
Yeah, that's a great question. And that comes up all the time. But that's, and actually I was disappointed, frankly, to learn myself that that's still processed because of the nitrates. They say there's natural nitrites that they use, but even the natural ones that they use, just because they're natural, doesn't mean that they're safer. And I was surprised to hear that myself when I found that out, because that's what I was going for at first, was like, okay, well, I'll go with the nitrite-free whatever. And yeah, big bummer. If you like, I mean, I'm Italian American, so grew up with a lot of this stuff, right, and loved it. And so, yeah. If you're going to eat it, I would just eat it rarely, I guess, not routinely. A lot of us eat these things routinely, and that's the problem, right?
Okay. Another question is, does elk/deer also cause the problems that beef does?
You know, we do know that elk and deer and any kind of game animal are healthier in a lot of ways, that they don't have those hormonal influences and toxins that you know, animals that are raised, you know, in a more commercial way have. They also don't have the saturated fat and a content, you know, it's a lot leaner. So in that way, you know, it's better. In terms of meat itself, and just the fact that it is some form of red meat, that it could be causing inflammation, there is that potential, but it seems that it is less. So it's a better, if you're going to make a choice, it probably is the better, it does seem like it's the better choice. But again, it's not where you want your whole diet wrapped around those. That's how I grew up too. You know, I always made a meal with the meat was in the middle of the plate and then everything else was around it. And so it's really about flipping the plate and rethinking how much of and how big a portion, and also how frequently we eat these products that could cause inflammation. So a better product, but also not as good as like a, you know, eating a plant proteins like quinoa or whatever it is, grains and beans and lentils and things like that.
Yeah, I love that, the mentality of flipping your plate. The next question is food related, and I did put a plug in for our next webinar, you guys, so we will be able to dive into some of this intro to plant-based eating more next month with registered dietitian Josie Reed, so save the date for December 8th for that. The next question, Dr. Shalz, is wondering about Greek yogurt. Can that be inflammatory too?
Well, so it depends, right? So Greek yogurt, well, you can make, Greek yogurt is like a process, right, of making a yogurt that's sort of got a lot of the fluid out of it, right? A lot of the water out of it. So it's sort of more creamy, more concentrated, maybe more proteins in that. But if it's still coming from dairy, it'll still have that issue, right? That it can cause it, especially if you're someone at one of the 70% who might have some antibodies to dairy and have, you know, issues around your stomach. Or skin, you know, it may still cause problems. There are plenty of plant-based yogurts that have the fermentation, have the bacteria, you know, the probiotic, I guess, or the bacteria in there that's good for you, that you can switch to. There's a lot of it. And I would say if you're going to switch to a plant-based dairy substitute, I would use more like the soy. Soy is high protein. Don't get the sweetened. I would get unsweetened soy or pea protein. Those are the highest protein, lowest sugar, just so you know.
That's great. Thank you. The next question is, if we need a low carb diet, how can we do that if grains and beans, etc., are higher in carbs?
The healthiest diets in the whole world are centered around complex carbohydrates. So that's a good point, right? So low carb diet is not shown to be superior for long-term health outcomes compared to a diet that is full of these whole foods that are mostly plants that, like you point out, are mostly complex carbohydrates. So not simple carbohydrates, complex carbohydrates. So that's an important thing to note, that there is no evidence that says long-term use of low carb diets is so much more healthy than any other way of eating. And in fact, it restricts you, right, from a lot of these really good nutritious foods.
Yeah, great call outs. There was a lot of people who really loved your slide and how success and just the pathway to, you know, creating new habits. There was lots of great comments there. And then another question is, did you say that cholesterol only comes from animals?
That's right. Yeah. And we don't need cholesterol in our diet. So if you're someone who's struggling with trying to lower your cholesterol, trying to be eating as many plants as possible and lowering your animal products will help with that, because our liver makes enough cholesterol. We don't need it in our diet. So the only way we're getting it additional in our diet is through animal products. It's a weird thing to think about, right? We don't really think about it that way. Same thing with fiber, only comes from plants. You can't get it from any animal products.
Yeah. And then at the beginning of the webinar, it was asked, I have heard that the U.S. has the lowest threshold cutoff for prediabetes. Is there a benefit or a cause to that?
I hadn't heard that. But I think, what it does, it indicates that, well, first of all, I would say insulin resistance starts to develop way before a person even gets identified as having prediabetes. So it, kind of have to back it up a bit. Insulin resistance is there before that blood sugar even starts to show itself as elevated. So I don't know. I never heard that before. That's interesting. I'd have to look that up myself. But I mean, we don't do anything with prediabetes except for hopefully we're A, identifying it, and B, giving advice around how to reverse that. And that is to lose weight, exercise, adopt a healthier diet, get healthy sleep, manage your stress, all the things I mentioned. Quit smoking. Smoking increases your insulin resistance and leads to diabetes as well because of inflammation, right?
Yeah. It was asked if it's possible to send us an email about the upcoming webinars. So our team will be posting this information on the source, so watch for that. And then if you're a weight loss challenge participant, we will send those emails. But when we send this slide deck, I encourage you all to go to the link that Dr. Shalz mentioned, because our team does offer a lot of other additional community education courses that you can join throughout the month. So definitely check that resource out. And then another question here for you, Dr. Shalz, is that does St. Luke's offer visits with a lifestyle medicine doc or NP or PA?
Yeah, I mean, our lifestyle medicine program, we actually, the way we deliver it, because we use the team-based model, is with a bundle of services. And visiting with me, and you can find out more about that, by the way, because we have free information sessions, and they'll go into all of the details about what that entails. But certainly my visits or my NP's visits are covered by insurance, including the St. Luke's insurance. But also, and with the primary care copay, I think, if you even have a copay. And then the rest of the program, our bundled product is $249. So just keeping that in mind, at least right now, that's what we're charging.
That's great. And then we have a question here. So many great questions. I love it. How quickly can you change your blood pressure with a plant-based diet? And can you truly reverse heart disease with plant-based food?
Well, I will tell you that Dean Ornish and Caldwell Esselstyn are the big researchers in that area of coronary artery disease. And they have shown remarkable results with their research and have written about it. So Dean Ornish's book, Caldwell Esselstyn's book, talking about the use of a plant-based diet to reverse coronary artery disease. And what they're seeing is just better blood flow. And really, even more importantly, what they saw was a decrease in cardiac events in those that what were they doing before they adopted a plant-based diet, then when they did, what happened to them, and compared them to controls. And it was unbelievable to see the marked decrease in cardiac events and mortality with people on a plant-based diet. So that's something to know about and to look into more. And then blood pressure can be generated by a lot of things. So weight, inactivity, sleep apnea that's untreated, stress, alcohol, tobacco use, all of those things, high sodium diet. So what I would say is diet is one component to helping manage hypertension and improve it. But yeah, I would tell you that it is pretty powerful, because a whole food plant-based diet does two things. It's like a DASH diet. You guys might have heard of that. That is actually for hypertension, and it's primarily a plant-based diet. And the reason it's so effective is that number one is low sodium, but number two is high potassium. And when you have not taking potassium supplements, but potassium in your food, your blood pressure comes down. It's pretty amazing. So yes. So you can, I don't know if I can say how quickly. It depends on all your other factors, right? That's why we're a holistic program. So.
Yeah, I love you mentioned DASH. I love the DASH seasonings. They're amazing. And then another great question. I know that supplements will never equal the benefits of actual food, but do you recommend any to help reduce inflammation?
I don't, there is the use, a lot of people are using turmeric for joint discomfort and inflammation in joints rather than using like ibuprofen, which is good because those drugs have lots and lots of bad side effects. And people, I think there's been some evidence that is helpful, that does help people improve their inflammation in their joints and their achiness. Otherwise, the only supplements that I actually recommend would be if you're going to eat mostly a plant-based or a pescatarian diet or a vegetarian diet, you should take a B12 at least once a week of 2,000 units or micrograms once a week, because B12 is in soil bacteria, and we just don't get soil bacteria on our plants, do we? Very much in this day and age. We're not just grabbing things right out of the ground. And so that's something, and if you're on a lot of if you're on metformin, you're on Prilosec, or you're on Pepsid or anything like that as an antacid, you may not be absorbing B12, even if you're eating a standard American diet. So not a bad idea to take B12. You pee it out if you get too much anyway. Vitamin D3, someone I just saw popped up. That is something that actually the USDA does recommend, that we all take some form of vitamin D3 because we mostly get it from the sun. A lot of us are low on vitamin D3, especially in the wintertime, and it's good for the immune system as well as the muscles and bones. And so a vitamin D3, at least for adults around anywhere from a 600 to an 800 international unit, all the way up to, I would max out, unless you're deficient, I would max out at like 2,000 units of vitamin D3.
So great. Thank you. And this is another fun question. How do you feel about products like Better Burger and other plant-based alternatives?
That's a fabulous question, and that comes up all the time because, I think it depends on what perspective you're taking. So if you're looking at the planet and planetary health and climate change and all of that, the thought out there is whatever is good for us, like as human beings, as animal, on the earth, is also good for the planet and vice versa. And so there's a lot of discussion now about commercial ranching and farming that could have negative impacts on the climate change. And so when people talk about that, they say, hey, now they're developing meats, for example, in the laboratory, which is like an actual animal protein in the lab. So that would be better for the climate, right? And then there's these other things that are plant-based meats. Now, those are probably in some ways better potentially, but honestly, there's nobody really knows if they're really good for your health, because some of them have components in them that are processed, right? And coconut oil, for example, which is something the American Heart Association recommends against using tropical oils, because right now that we know that they're so high in saturated fat, even higher actually in concentration than beef products. And so those are in the Impossible Burger and those other ones to make them, kind of fatty, kind of that taste in our mouth, that of fattiness. So if you're going to use them, they're not the worst, but they're probably not the best. They may be neutral. I'm not really sure. So if that's a good enough answer, just remember that it's still a processed food. You could still use it. Maybe not the best, not the healthiest, but not the worst either.
Yeah. Super helpful. A few comments. You've inspired me. Thank you, Dr. Shalz. I needed all these reminders. Thank you so much for speaking today. We'd love a copy of your presentation. We will send that out to everyone. So thank you so much, everyone, for attending. And thank you, Dr. Shalz, for the time. We thought this would be 30 minutes, but with all the great interaction today, we've kept you longer than we asked you for. So we appreciate the extra time. And everyone, just thank you for joining us. December 8th will be your next webinar with registered dietitian Josie Reed, who is amazing. I know her, and she's going to really help us dive into what it can look like to actually eat more of a whole food plant-based diet. So shifting that plate around. So join us for that. We'll send out Teams links then, and we'll see you guys next month.
Okay, it's great. And Josie's on our team, and she's fabulous. So thank you so much. I appreciate being here. It's an honor. Thank you.
Thank you, Dr. Shalz. Thanks, everyone. Have a great day.
Thanks, everyone. Bye-bye.